Well, with the news about the vaccines, I think there are some people who assume this is kind of like a movie where we've had the pandemic, the vaccine is here, the cure is here, it's over. And so we have sort of a VJ Day type of celebration in Times Square and move on. That's not exactly how it's going to work, is it?
No, it won't happen overnight. The good news is that help is on the way. The vaccines, which have been now put together and tested rigorously at a timetable that's never been achieved before, are close to the point of receiving approval in the United States for emergency use. Just let me say a word about how these vaccines work. This is this virus that we're trying to figure out how to get rid of. It has these spikes on the surface. These are proteins, and it's actually called a spike protein. And that's the part of the virus that the immune system recognizes. And if you got sick with this virus, the immune system would figure out most of the time how to get you better by raising antibodies against those spikes. The vaccine aims to give you the chance to raise those antibodies without having to get sick. And so basically, doesn't give you the whole virus. There's no risk the vaccine is actually going to cause COVID-19, but it will make a little bit of that spike protein. The ones that are currently being closest to approval allow you to make that protein in your muscle after an injection in your arm. And then the immune system goes to town and builds the defenses that you will need. And if in the future, then you encounter the real virus, the immune system is all primed and ready to go and says, oh, no, you don't. That's the strategy. The strategy looks as if for this virus, it's going to be pretty effective. None of us really knew with this particular virus, which we hadn't seen before, would this kind of strategy give you a high level of effectiveness? We kind of held our breath as we went from phase 1 to phase 2 to phase 3. And then for the two vaccines that are furthest along, Pfizer and Moderna, we were delighted, thrilled, amazed to see that it looked like the effectiveness was about 95%. That is so much better than what you could expect to see with a new illness of this sort. And the safety looks really good as well in 30,000 people for each of those that have had this and who have volunteered for these trials. So we're on a very good path. And the other thing that was done, Russell, was in order to try to speed up the process of saving lives, is that we've started through something called Operation Warp Speed to manufacture tens of millions of doses of these vaccines, even before we knew if they were going to work. If they hadn't worked, we'd had to throw those doses out. But fortunately, they're there so that if, as expected, these two vaccines get US approval later this month, we can start immunizing people immediately the next day with about 40 million doses that are already ready to go. Now, one trick here is these vaccines are not a single injection. There's an injection, and then a month later, there's a second injection, sort of like a booster to really rev up that immune system to give you the best protection. So 40 million doses means 20 million people. And you might have noticed just a couple days ago, the CDC's advisory committee recommended that these go first to the highest risk people, namely healthcare providers who are in harm's way by taking care of patients who are sick with COVID, and also elderly, high-risk individuals in nursing homes and assisted living facilities. They'll be first in line, and they should be. And then over the coming months, as more vaccine gets produced, we will figure out how to get this ultimately to all Americans who are ready to accept it. And that's something we probably need to talk about, because if we don't see wide acceptance, the potential here of this to drive this vaccine out of our experience could be muted or maybe even fail altogether. We need to figure out how to get most of the country immune.